no condition.
The condition is permanent.
No condition.
The condition is permanent.
No condition.
The condition is permanent.
Like we are living, my bedroom is full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. Cause today is me, tomorrow might be you. Cause no condition.
The condition is permanent.
Cause no condition.
The condition is permanent.
Cause no condition.
Inside the program Well Body Talk, we always talk about different sickness, wetin dey cause am, treatment and prevention. And safe, we also talk about the signs and symptoms. Inside the program Well Body Talk, we always get experts in the studio for talk about different sickness. And inside this edition of the program Well Body Talk, we studio guest now Dr. Hassan Ekonte, in a resident doctor of family medicine department na the University of Salon Teaching Hospital Complex. And today inside the program Well Body Talk, we dey talk about the place of first aid in our society. Why, when, where, and what. And when being done at this program, my name na Conte. Remember, say yourself when you listen and watch me live na Facebook. You go be part of the program, but why go send a comment or text message to the number 077981981, or say if you go now already democracy social media platform when our Facebook and YouTube, and ask a question there on the topic where they do it today. And self later on inside the program we go open phone line. Most like people will call the number 077981981, 077981981, and the number where you can call later on and ask question. But the topic where they do it today, when at the place of first aid in our society, why, when, where, and what. And I want to welcome my studio guest, when our Dr. Hassan Ekonte. Good evening and welcome to the program. Karifatu. Yeah. Okay. So today we will talk about the place of first aid in our society. That's for tell family and force. Waiting our first aid.
First aid, the treatment we they keep us in, we sick or injured, and a particular health facility for further treatment. In our first aid.
Okay, so now you don't talk about that. A lot of look at the different. Is not saying like way person they get an attack. Look at the different sickness, like way person go say go able for give first aid treatments too.
Okay, like the different sickness way somebody they get, we they give first aid to one, like at the community we can get different things there. Might say example like burns. Now one because are something common to picking them and to even the elderly. Two, they think of maybe snake bites as something common. Three, it can be like a person get accident, either in foot broke, you understand, or any part of my body person get problem in bone broke. So you go for give first aid for that. For like a person get heart attack, like what you call acute coronary syndrome, like myocardial infarction, a person can get heart attack. So if you're in a person where they near you go find me again that first aid for before they will go to the nearest health facility or before the well body people they come inside.
For law take bonds for instance we just mentioned the four thing wey say people can give first aid to. So like if person in a community like we maybe we say they go for go take treatment or for go na the nearest hospital go see say e go get a delay. Wetin are the first aid treatment we go give to person we go born?
Okay, because we get different types of burn, you understand? First of all, we want to give first aid to a person, you try to watch the environment first. You understand? For me, you be safe because person where they go get a first aid to person, you get to watch the environment. For me, you make sure the environment safe for you before you try to intervene. Like a person get burns, what did they try for do? Try for removal at the burn area. When you remove at the burn area, you try for, if you are close thing where anything you try for remove param, after which, and then you try for use running tap water, like for 10 to 15 minutes, you pour to the person at the burn area, and then if possible you can get antipyretic like paracetamol for the pain, for me it relieve the pain. You get paracetamol before you can go to the nearest health. It's try for take something will clean, it cover the affected, if now gauze or anything will clean, cover the affected bone area, and then you rush to the nearest health facility or you call Bodi person for can help now.
For one thing again, what I see we common now that we like Komora mostly one attack into we pan the pikin. So it's not the first area that Komora they go give first to the pikin before you go to an hospital.
So like I say, now water one in tap water will clean if na pump water or one in tap water you pour at the affected area because most of the time Komora they collect for use maybe palmine or mud or use egg. Now they sometimes you knock in ice. The best thing we can you just use water, running water, it turn up for me the pain you understand will relieve and the hypothermia we call hypothermia, the heat, the temperature for me will reduce, and then it's time for them now just keep that paracetamol they keep picking very good now because when I can give them this more like they take more then take the other thing it can affect the affected area because sometimes when say you want sterile we get what to call ubiquitous organism like and tetanus where they all over the gone. So if you go take more you put them particular bone they find out say they predispose them to tetanus. We get what to call tetanus and clostridium tetanus where they all over the gone, you understand, where ubiquitous you find any sign of the area. So if you take mud, you put up a pikin for try for elevate in pain, you know, find as first aid. The first aid where they get to pikin we born, just spray water, cool water, you understand, and then rush to the nearest hospital.
So now look at the other area where we talk about snake bites. Plenty time we don't they see now different community them like we say oh snake don't bite that person. They say tie up or tie outside the wound. So it's not the first aid treatment where people go get to where person with snake bites.
So like for snake bites, in back it try for use, you understand, try for apply water, it clean the place fine. Sometimes people like use that stone. You understand? It's serve as antivenom. We just try to clean the place properly with running water and then you go to the patient now the nearest hospital because
it's safe for the person where they clean that so they way the snake don't beds for them church and everything naked hands.
No, it's not safe for me. Just use gloves, you wear plastic like yarn, try for clean up when they rush to the nearest hospital. Because antivenom now they get to pursue snake bites. Getting kind medication in this. So to me, the kind thing they go for doing we just try for clean the area and wash it at the nearest health facility.
Okay. So again, the other Lord just look at the four thing them way we just mentioned. The other one gets to do with accidents. Yes, yeah. Where person go for rump and bike or bike bangam or car bangam we normally came. Waiting at the first first aid treatment we go get to person like way you go get accidents.
like person wey can get accident because we get different types of injuries, you understand. So in that regard you need, like I be say first, always wey you try for safe first, you wey that first aid to person, you always try for find the environment for be safe for you the person wey dey go do the first aid. Okay. So you try for pull the person na the area of accident, and then if the person dey bleed, and the first thing you try for arrest the bleeding by compressing, like use gauze or use any something for compress that outside the bleed. You understand? It's try for compress that outside the bleed for me the person not go into shock, because if they bleed too much, you find out say the person they go into shock because they lose too much blood, they go into hypovolemic shock. So in that regard, you need for try to compress the place first. We compress it, wait for tidy. Now pieces you use the tie or you use gauze or use something to make compress inside the blade. After which, if now your foot time broke, if you can use cartoon, try for the other foot you wrap out the cartoon, you align and you wrap out the cartoon tie. You understand? That time now they can go to the person that the nearest health facility.
Okay. The program now, well, Bodi Talk, they come to live from the Society for Radio Democracy 98.1 FM. In name now Dr. Hassan A. Conte, in the resident doctor family medicine department na the University of Salon Teaching Hospital Complex. As today they also for talk about the place of first aid in our society, why, when, where and what. Also I would only talk about the different thing that wake it happen mostly now community on how people for the give first aid before they take the person the well body facility. We don't talk about burns, snake bites and accidents. So now they can look at we can talk about heart attack and self-bleeding. So yourself can be part of the program, but I go call the number 077921981 077921981 at the number where you go call and ask question at the program pertaining the topic what they do with today when the place of first aid. What's some of the thing where you want to know, or you don't experience something, or till you want to know, say, hey, if this happened to my family or my neighbor, waiting at the first aid way I forget to you go call the number and ask as we get the experts in the studio with me. So let's look at again the other way talk about heart attack where plenty children say, hey, then in heart attack again before they go to hospital and they die. So what's the first aid treatment where like a family member or neighbor or any other person go get to person way get heart attack?
Like a person get heart attack now like a sick way be say it affects the heart muscles. Like when blood in the flow well now the heart muscles then it leads to heart attack. You understand? So like in that case, when person hold in chest like chest there get heart attack, you need for call for help. You shout for help because there's something we handle the first aid and you have to get assistance. You are getting able. You shout for help. And then we get what to call cardiopulmonary resuscitation. Where they try for resuscitate the patient. You get 30 compression, they use this to 250 here. You lay under the person in sternum by in chest bone. In chest bone, you call sternum. You begin compress 30. You understand? After which if you get oxygen max, you get what to call
so
oxygen.
do you when you compress, is it that they use out force on a just soft?
You don't need for it go use it may go to go they try for putting needle on, you lay the person flat. Now the beer gun, lay am flat, you try for put you in knee down for make get more stamina for compress the chest. Okay. 30 times, and then you use your mouth or you use ventilator, you blow the person in mouth for help and forget oxygen 15 times. So that's what you do cardiopulmonary resuscitation. You compress 30 and you blow. And so you go do them. Say how that person might carry because you go tired, you go exhaust. Before they call ambulance but when they can take the person. So that's what you do.
So you don't get any other like medication where you go give the person?
Sometimes people like can give aspirin. Yeah, if you are get aspirin, can get aspirin because aspirin are a blood thinner. You know, it help for me thin the blood. For me the blood go to flow and me will kind of the heart muscles because like where there is obstruction, now the flow of blood to the heart muscle and it leads to heart attack. So you can get aspirin. The person get aspirin before you go to the hospital where they use that compression I tell you about 30 compression and 15 breath.
Let's take you back to accidents because that's not thing where they happen every day. Most time we don't see like if Okada or Mutka bank person, especially in foot, you see also some person go carry say let's sit down for straight in foot. So at that moment, which are the first way person for do? Where person gets accidents, yes. That them bang and in foot. Mostly we can say other person go carry say let the person sit down for straight in foot. And waiting the first thing where person for do where person gets accidents, they could them bang in foot.
So if they bang in foot, like I'll be explained, if the person don't get any open fracture, because we also call open fracture and closed fracture. If not, the person don't get any open fracture, you understand? They try more for making a rest, try for align the foot to do hands. You understand? It one for me the bone they will align. Use na cartoon, then cartoon they wrap on the foot. It's okay. Before you go to the nearest health facility.
Okay. So now look at the other area we get for with bleeding. For like woman where it just born, it don't discharge, it don't go na os. Then all of a sudden it can get bleeding. Waiting at the first state treatment where you go get to that woman day.
Woman born in the bleed. The first aid treatment when you young, if you didn't at the scene, and it's time for massage the uterus. They use your hand, they massage the uterus because what they cause one of the causes of bleeding are uterine atony. What you mean by uterine atony? Like what the uterus they contract. You understand? So if they contract, if you have say the woman they bleed after you don't born. So you go try for massage the uterus, but when help the uterus for contract. Where don't massage the uterus? If you get away, you try for put. You understand? If now like clean gauze, you put her inside the woman in vagina for just talk. You understand? For me, just stop the bleeding until you go to the nearest health facility. Because now the nearest health facility, they will be able to give you the correct treatment we need. You understand? Because for you won't first you do try for massage the uterus, for me help the uterus contract. If you get away, you put something inside your vagina for like clean gauze or use clean pieces. Put her inside for me stop the bleeding. So that's what they do for the woman when you call for help. Nearest health facility go to them when they go help them out.
For person we get bleeding from the nose, we normally can call sinus. Waiting now the first aid treatment where you get.
Like when you get bleeding at the nose, just try for all the tip of the nose. You try for all the tip of the nose. That's why the Ola. You go like that research facility. Just try for all the tip of the nose. Go like quicker. You go to the nearest facility because sometimes like in somebody they say they get adrenaline, but sometimes you go they know get adrenaline. You understand? So just try for all the tip of the nose, compress them, and then you go the person in the nearest facility.
So a plenty say don't they suicide person they say take charcoal, you put under the nose, the bleeding.
Yeah, some people they can use, but to me scientifically no make, you understand. But me ultimately the advice person just compress all the tip of the nose and then go the person in the nearest health facility.
Okay. Another thing again I want to look at now the one we get for do it people we get epilepsy.
Okay.
We normally can call fits where someday it just for them maybe it go in a tongue on a community in for them, and mostly people can afraid for church them kind of people and they think say because no not get sabi body sick or itself. So doing that way that person they follow waiting at the first aid treatment we go get to that person they.
So like first thing when we get epilepsy, if I say treatment where they get we person for them. The moment we for them try for help them, me protect them for me, you know. Because for still, if they give person for still, for me the signal worsen. And two, for me the person not deteriorate. They make it give person for still. So, when person get epilepsy, get attack, if for them, try for remove a danger zone. Okay, you try to calm or they see say it hit it in a outside stone and then they hit it. Try for remove and there. And try for protect the head. May not be knock head. You understand? And then if you get that tongue bite, if possible you use that go to call spatula. Or some people they use spoon. You understand? For me it protects for me the tongue not fall back. Because if the tongue fall back, you get what you call acute respiratory arrest. Like you need to blow well. You understand? So now that they try for protect them for me, you know, they continue for knock head sometimes like stone and they protect the head and two, you try for protect if the betting tongue, try for you something in mouth, mainly for the betting tongue. And three, you pull them from a danger zone like if streets or any side outside if you say you're not comfortable for you, try for remove and then. Because some people afraid they know how to church and may not get epilepsy. Epilepsy not something very transferable. Now like now sickness we due to the misfiring of the impulse in the brain. So now they lead to epilepsy like where the impulse is there and the neurons they misfire. You understand? So now they cause epilepsy.
Okay, a name now Dr. Hassan A. Conte in a resident doctor of family medicine department na the University of Salon Teaching Hospital Complex as sitting inside the program we dey also for talk about the place of first aid in our society, why, when, where and what. And Fambul yourself can be part of the program by way of call the number 077981981 077981981 at the number where you go call and ask question about the topic we do it then at the program when at the place of first aid in our society. What you need for know about first aid, waiting are some of the things we do experience in a community like where they happen like community we go on for get help so before they go to the person at the nearest hospital. You can call the number 077981981 077981981 at the number where you go call and ask question at the program as we get the experts at the program with me. So now let's look at again another thing where people from how important first aid and treatment be. How important first aid treatment be?
Yeah, first aid is very important because we give first aid for one we elevate the pain from the person. You understand? Like man say again analgesic at the moment of when the person get the accident, when the person get the attack, again something where they elevate in pain. And I want to it give person for say for me the person in sickness gets worse. They make it again first aid. Three, the give person for the may not deteriorate. Entity the give person for the again for me elevating pain. If we get accident, again analgesic before they go to the nearest health center or they will people in time for cancer scan. Again back like once you have to attack it's kind for in some states the sickness now gets worse. You understand? Or it's guy for help family with 6 years for me like deteriorate. I make what they give for us. So I make for say very important in the society. Okay. And everybody can give first aid. Any side where you will give first aid.
So now look at again with how important it be for the institution or person a host go get the first aid kits and waiting are some of the first aid kits then where people forget na the host institution.
Okay. For safe kids the way family forgets that the institution, now we own them, now we school them. We go nice when we get like a bag or so again we first aid kids them. So we put paracetamol, we aspirin, so we put gauze them, we put small scissors, you buy what's called Povidone, you get your plaster, you understand? And then thing you get your hand sanitizer, and then thing you go get na hose in case emergency happen. And then thing you find for the inside for state bag. As I said, you get your paracetamol, you get your bandage, you get your gauze, you get your scissors, you get your plaster, you get your aspirin hose. Anything that nice for get them, now you host or now your community or now you station way there or now the school way you find yourself, you get your hand sanitizer, you get your Povidone. Anything they find forget now host in case something happen. So now.
Okay, continue for the treatment at the program in name na Dr. Hassan A. Conte in a resident doctor family medicine department na the University of Salon Teaching Hospital Complex. As today inside the program we talk about the place of first aid in our society, why, when, where and what, and what you want for about first aid, waiting are some of the first aid treatments that we go on for give to person we get accidents or snake bite or end dog or self inborn person goes past something, you get heart attack. Waiting at the first aid treatment we go on for land, you go call the number 077-981-981, 077-981-981 and the number where you go call and ask question as we get the experts now in the studio with we. Now inside the program, now not time for make we take break.
Daily courage. No condition.
The condition is permanent. Yeah.
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 Life we are living, my bedroom is full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. 'Cause no condition.
The condition is permanent. Yeah.
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 This is Chipmunks Music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah. No condition is permanent. You never know if someday you will find yourself in that same situation. In this life, you've seen today, tomorrow is the promise. In a twinkle of an eye, your story might change. Be you black or white, no matter your personality. Be you rich or poor, your story might change. 'Cause no condition.
The condition is permanent. Yeah.
'Cause no condition.
The condition is permanent. condition is permanent. Oh yeah.
Cause no condition.
No condition is permanent. Oh yeah.
Shout out to you, white priest. YUK man of the moment. I salute you.
Well, family, the program now, well, Body Talk, and they come to a live from the Society for Early Democracy 98.1 FM. And where they bring to now this edition of the program, in name Kaifa to Conte. And today inside the program, we talk about the place of first aid in our society, why, when, where, and what. So, family, yourself go be part of the program, or I go call the number 077981981, 077981981, and the number where you go call and ask questions, but sweetie one for no but first aid. Waiting at the first aid treatment where you go on for gi in case people na your community or self na street you go want for no we go get accident. Waiting at the first help we go give that person if we go na hospital. You can call the number 077981981, 077981981 at the number where you go call and ask question as we get the experts na the studio with we na Dr. Hassan Ekonte in a resident doctor family medicine department na the University of Salon Teaching Hospital Complex. So Dr. Conte, Lord look at again another thing we get where plenty time we can see they say this person get shock. Like waiting how that it can be like to person and waiting at the first aid treatment we can get to that person there.
Like for shock, like I mentioned just now.
So more take first caller because like I think we're asking question. Hello, good evening. Name and where you call from?
The call from Wilberforce.
Okay. Go ahead.
I just want to ask Doc one question.
Yeah.
In a case where a dog bites somebody or snake, these two animals, I want to know the first aid, which is very much important for able to be spotting the quitting dogs or institution or become worse or deteriorate.
Okay.
Thank you.
Okay. Plenty. Thank you for that question. The doctor will answer later on. The number for call and ask question is 077981981, 077981981, and the number where you go call and ask question about the topic where they deal with today. When I first aid, the place of first aid in our society. The number for call now 077981981, 077981981, and the number for call. Well, this person, I don't know if now flash the flash, no flash the line, call the number. Hello, good evening, name and where you call from? Hello? Okay, we don't lost that caller there. The number for call now 077981981, 077981981, and the number for call and ask question na the program. Hello, good evening, name and where you call from?
Yes, good evening. My name is Emily. I call from college.
Okay, go ahead and ask the question.
Yeah, the question was, now since I want to be how the first question in case of snake bite, waiting at the first aid, who side for go for treatment? You can understand not all hospitals treatment can increase.
Okay, thank you very much, Emily, for that question the way you asked on the program. The number for call and ask question is 077981981, 077981981. More calls inside the program. Hello, good evening, name and where you call from? Well, we don't lose that call already, so don't kick answer a quick one. Today we get to do it dog bites and snake bites, and the second person they ask back the same question, but he also add say who's a person for go for treatment.
Thank you very much for the question. In case of dog bites, you understand, where dog bites you, a community or any side, where you feel safe, the first thing we need for get the person, you just need for tourniquet or pieces or anything. It's at the inside the person, but above. You understand? Inside the dog, but above. If at the leg, it's above the leg. Use water. You clean the area. We clean the area with water. You pour enough water. Time for clean. Use gloves or you wrap it out with plastic. You clean it fine. We clean it. You can drugstore. The name anti-rabies because dog bites. You don't find for delay time. The more you delay, the more. So now the same moments where you don't get the rush car. The rush car. If you never can add it, the following the make sure say time for come. Name on the drugstore. Then I can give you rabies vaccine. Okay. You understand? So same apply for the snake bite. The snake bites like I said, just the time for tidy the area. You pour enough water, they clean it. You clean the well, and if you go to any government hospital and big hospital that they country, government hospital and big hospital, you can go to Connaught, you can go to Kiama Road, you can go to along the government hospital. You understand? Because okay, so now take away other call on the program. Hello, good evening, name and where the call from?
Yeah, good evening, Carissa. I was trying to call from Manchester. Well, I thank you, Taibu. I just feel things for the doctor. I don't know if you remember one of the popular artists, I don't want to call him, maybe they die, they get problem at the road accident, when I'm in brain. I think I start to be took to it. So, okay, but the first thing we will see during the time when they send their photos, and which is all right, well, we will see the photos. Then they sew, then they try for sew the wound. And been try for so there's that one time to one of the brain surgeons, Mr. Kamara, who been doing one to the studio. How will I be able to enlighten people and forgive them kind of first thing because in the head, we possibly the pressure already high. Integrated pressure, so that will back to the back. If we're able to open and loose, put a gauze, and then bandage and loose it. But I know how more effective is that. The second one, now for the chicken, like I said, the chicken choke. When the chicken choke, how you go able for first aid? Because one, if you choke, how you able to turn around, tap on at the back. And then the other one, in case sometimes you choke back because you cough, you put a get productive stuff in the hamburger, how you able to tap it back, let us sit in the tomato and expectorant, like that. Then I want to then how you will give the picking mark the insensitive of first aid in terms of compression and breathing. Like you want for research to the pressure, you know, we'll be on the same compression because of the stand on the week. Then I want thing. Then the final one, I really people will not ask you too much about this snake bite. I'm not saying like it's a little will be get. First and then they use looking like a stone, who they absorb that and they go. Presently, I just want to remind you, make if you get any chance for when the minister or other people in Meridi, they don't discover like Liverpool a kind of a treatment for snake bite. But we get linked with that Liverpool tropical disease hospital day, Nasano, so we will tell them, let them see if they might. But make us go lesson now because we cannot they done. But those are the things in terms of snake biting when I think we very, very delicate for doing with them. Thank you very much. You did a good job. Thank you, sir.
Thank you very much, Oswald from Manchester City. So now we come to Dr. Hassan. The number for call now is 0779291. We'll get another call on the program. Hello, good evening. Well, we don't lost that caller in the program. The program our Bodi Talk and it comes to live from the Society for Real Democracy 98.1 FM. Yourself can be part of the program by way of call the number 077929191, 0779291, and the number where you call and ask question about the topic we do with today at the program when first aid in the first aid, you know. The place of first aid in our society, sorry, why, when, where, and what you need for know about first aid or waiting as some of the first aid treatments the way you want for know, you can call the number 077929191, 077929191 at the number where you go call and ask question at the program. So, Doctor, yes, you can answer to Osfred in questions then.
Okay, thank you very much, sir, Stanford. Concerning the brain injury, like the the late Steady Bongo, like we get brain injury. In terms of the first thing we expect from people, in terms of brain injury, just try for stop the bleeding. You use gauze, you pack them, you use bandage, you just wrap them lightly, may not tighten too much for prevent intracranial pressure, and then you go to the nearest health facility, because some thing they can do, like possibly like then can injury there. So my just can go no more, go begin to tighter or do something where they worsen the patient's situation or the person's situation. So you get for very be careful with them kind of people. Even like if a person gets cervical injury, if you know how for handle that person there. We get different maneuver that we can use. Like a person gets spinal injury, but very be careful how they handle them kind of people there. Don't they turn them around, because if they turn the neck, the worst in the situation. They make the end of the person end up forget paralysis. So we not go good for the person. So in that regard, you get for just apply gauze. First you get brain injury, they bleed. Apply gauze, it tie with bandage, and then you go to the nearest health facility as quick as possible.
So you also talk for choke for picking them.
Like for picking them, like I say, we go to call back thrust. Like then picking them when they under 5, just hold out with this your right hand. Your left hand. Like by the belly, you use the right hand, you use the thumb. You use the palm for knock the picking in back. You understand? When they knock him back, move forward. They knock him back, move forward. At time they picking with he choke up with you able to go out. If they are like them big picking like 8 year, we go to call abdominal thrust. So in back he just put his hand in abdomen, he lifts her up. He lifts her up. You use it, you hand in abdomen, he lifts her up. At time they you will pull out here, you don't get inside in throat for you to remove her on a mouth. Try for use your hand, like abdomen like them above 5 years. Or below 5, you use your left hand, you hold the picking, you use the right hand, you use this palm, you hit her by him back. Until the OT don't get swallow, you use them 5, you apply them 5 times. 1, 2, 3, 4, 5. At time they go able remove what you don't get in mouth. So that kind of festive they give possibly get foreign bodies in mouth or in throat.
Okay. The program now will Body Talk, and it comes to live from the Society for Radio Democracy 98.1 FM. Yourself can be part of the program by you could call the number 077-981-91, 077-981-91, and the number where you could call and ask question for Sika the topic what they do it today when the place of first aid in our society. What you want for number first aid? What is the first aid treatment waking it to anybody who gets accidents, snake bite or dog bite or any other thing where you feel say you need for know for protect your family or self neighbor or any other person where you go on for render help. So the number for call and ask question now 077-981-91, 077-981-91, and the number where you go call and ask question about the topic where they do it today. So don't look at another thing we get for the shock where you want for talk but we call us then begin for call and ask them question.
Well, for shock, we get different types of shock. Like if you get accident, you understand, if they bleed severely, you try for arrest that bleeding. Because if you not arrest that bleeding there, if you not try for compress, you try for arrest that bleeding there, you understand, the person they go into shock, we call hypovolemic shock. We get different types of shock. But like that kind of shock, then the more I expect like a person get accident, you understand, the hypovolemic shock, because they bleed. You understand? We get septic shock, we get cardiogenic shock, like, you understand? So we get different types of shock. So like for For person wey dey bleed, try for arrest the bleed, make no go into hypovolemic shock. The other shock when allow the person you go to hospital and they will manage am for you well. You understand? One person dey bleed, try for prevent hypovolemic shock, arrest the bleeding, use clean something inside the bleed, or use gauze compress for me because the blood naturally get to clotting factors. We compress there is clotting factors where they come around and try for stop the bleeding. You understand? We make the person not go into that shock hole they try for say. You understand? So that's why they try for help person where get accident where they bleed severely. Make sure say you arrest the bleeding. Don't go for suicide like if the foot and broke or this. If you get any wound, and the first important target, try for arrest the bleeding. Before now, you call Bodi people.
Okay. The program now with Bodi Talk and it comes to live from the Society for Any Democracy 98.1 FM. Yourself can be part of the program by way go send a comment or text message to the number 077981981, 077981981, and the number where you go call and ask questions about what you want for no but for state and waiting as of the team where you want for give for state treatment so you want for get sabi bottom, you can call the number 077981981, 077981981, and the number where you go call and ask questions. So Dr. look at again another thing we get to do with fever, where people normally I can say that they can say, hey, I get fever or my pikin get fever. What are the first state treatment for so we go get to that pikin or big person?
Fever is something where person can get where in temperature can get above normal. So when person can get fever like pikin, what do they try for do first? More try for TP sponge out. We have to call TP sponge. We use pieces, soak them, water, squeeze and fine, begin the rub rubber. Or you put on in back, in chest, in it, try for rubber.
Okay.
At least for me, the temperature will kind of small. The TP sponge, even for big person, when you have a person with 6 severe get fever, when temperature there above normal, you try for TP sponge. Use pieces, soak them, squeeze and fine, you rub rubber in body, try for apply in head, in back, in chest. Understand? For me, the temperature will reduce. If you get paracetamol, if you boss able to drink, you get me drink. Try for sick the nearest health facility, or you try for call the Bodi people and for can help you.
Okay. The program now where Bodi Talk, it comes to live from the Society for Any Democracy 98.1 FM. Yourself can be part of the program by way you call the number 077981981, or self you go now where the Democracy Facebook page and ask your questions there. As I take another message now, Facebook page from Uswe Kamara, they say the recovery position is also worth explaining. Also, certain shocks due to low blood pressure, the victim must be tied from trunk to the feet, tied from trunk to the feet to enhance blood circulation in the head. So the number for call and ask questions now 077981981, 077981981, and the number where you go call and ask question about the topic where they deal with today in the program. So like person wants for know if like also if for instance accidents be na is it that it is the person first say lo is a log go to a place before again for state treatment or na outside the person gets the incident it again for state treatment one time
where person get accident if na street try for pull am first na street.
Okay.
You know, because you go for protect yourself. May not let me do something, so man the cow to your own trouble, you can't pass it. German. You understand? So always suppose you get accident na street or any side. The environment supposed to try for be watch if it's safe for you, the person will go to the first aid. Always try for watch the environment if it's safe for you. If it's safe for you, how time they do am. If not, we say it happen if the environment safe, you don't say any other no can they, you know, and them. But if you're not safe, remove the person there. Go to outside safe. That's what they do for state for person. Because you safe first, suppose you don't get some accident or any other injury or any other sickness, try for protect yourself first before you help her. You understand? That's why they help person in terms of first aid. If you see say the person side the incident happen, it's safe for me, you render first aid for him, you're okay by that. But if you're not safe, remove him there, protect yourself, remove him, go to the safest side and do your first aid. Really do to the person.
Mostly we can see people can get hand problem where they say a hand shifts. It come out in position. So what are the first aid treatment we go get to then kind people and if you didn't the same?
If the boss they say hand shifts, feel pain, you just try for like opposite hand shift, it hold on up here and then you apply force. You apply force. Try for pull and down, you apply force to put on inside. You understand? For me the hand will go inside the joint space. You understand? So I need to try for do for the person. If now pain medicine person can because it's very painful and something painful. You get pain medicine, you hold on inside like if this hand and you hold this so you apply a force, pull and down, try for put it inside. So now you go make you go in position back. When you go in position, if now arm sling, take like pieces tie in neck, it's hand back na hand. It's an say me go na the nearest clinic.
For person like we go out for drown, then go pull her inside water. Then come with her, how you they able for give that person for state treatment? It's not for state treatment where they give the person.
Person we drown.
We want for drown.
Okay, we want for drown like we come inside water.
Yes.
Maybe go don't swallow enough water. Try for compress in belly. You understand? It compress the belly. For me, you pull the water in belly. When you don't pull the water in belly, like you go to try for compress the belly. For me, you vomit the water, and then you can go to the nearest hospital as quick as possible.
So what about the one that we can come up billing for don't candle?
The kind of case then they opposing come up billing for them. Sometimes they go into coma, they go in unconscious, you don't know yourself. That kind of case then they try as best as possible for me call ambulance when they can rescue that person there. Try as best as possible for me call ambulance, they can rescue that person there. Then go to the nearest health because you don't get police coma. And police coma management, you find me the manager in the hospital, no manager. They will bring for state to police coma. Maybe hand don't book, this don't book, I'll call police come get different injuries there. So you go for try as best as possible to call ambulance and go to the nearest hospital.
What are some of the sickness them or incidents them where can happen or where person can get where at all no need for stage now for just rush the person go to hospital?
Like that one I tell you so police come bones, especially picking way born. No waste time, no paper doctor picking up born because we have to call hypothermia. You understand? Hypovolemia, hypoglycemia, picking quick. That is kill them. You understand? So we born. Try as best as possible. If that didn't pass you, you know go to the hospital. Now, first thing that money go to the hospital. Maybe in a net, me no net, or if say they outside the hospital, they far. First thing, before they say do prayer time, you don't go to because if you don't have picking the loss because when they see come over there, when they picking they get severe burns, they go to they go paper doctor and first. Okay. If you not put manager well, they not get enough fluid. That picking they go into shock. When you go into shock, you don't lost picking. So we picking get burn. That is not to tell you for joke. It's always just 3 water per normal. Cold water, 3 water per try for wrapper. Would clean something. If not lapper, clean lapper, wrapper. You go to instant hospital because they need for good down fluid. That picking if they not resuscitate and properly, they end up for lossy picking. So that means anything in the bones, polytrauma, person get heart attack, not something wait for his time. Go to as quick as possible.
Okay, so it's a message where you left now to people for say on how or waiting at some of the thing where for give for state treatment, so waiting at some of the thing where you for rush the person go to the nearest hospital.
The message why I left to family, it say the society will find itself people collect for by chance, you understand? But where it's by chance, then can lead to something where the outcome not go good. It go nice for where person get any illness where you know say this now medical person need for intervene. You go find for me, you go see person at the right side for me help out, for me get the best outcome. Then you begin the bypass, go to first at the pharmacy or you go to first so a nurse na host or any health worker na host wey be say you know appropriate. We person sick, we person get any issue, get a basic first aid. Like that the basic first aid you get na host like maybe you get fever, can you person get a piston the person, you get paracetamol, then you go to hospital. Because you don't know what thing cause the fever. Fever, person get fever because there is underlying illness. So what thing cause underlying? So you're not going to treat alone blindly because the person don't get fever. Okay, I go to treat alone. No, just apply. If not, postpone the picking. Because picking, if they continue to get fever, then can make the picking they can convulse. Picking they can convulse. Picking are not able too much high temperature. They make it a convulse. A convulsion not good for picking. So just postpone the picking. If you get paracetamol, if you can able to drink medicine, you get paracetamol syrup or you get the tablets, and then you go to go to hospital. Then they go find out why made the picking get this continuous fever.
Okay.
You understand? And so, like if you became born, just apply warning water for 10 to 15 minutes, and then rush to picking at the nearest hospital. No go and manage that picking now also you go to the nearest side where you be said get appropriate treatment. Because we can see most of the cases then are called hospital. Some picking and they like you don't mismanage and then go to the hospital. And you can make picking sometimes so they will rescue them. Even cottage, like you don't mismanage the picking and now let them go there. And then you know can sound well so really well for the people there. Because they make within a community, they make within a society where you need any help, try for sick the well body people there.
Okay.
Advice.
Okay. Plenty thank you. We're joining at the program. In name now Dr. Hassan Ekonte in a resident doctor family medicine department na the University of Salon Teaching Hospital Complex. As today inside the program, he also for talk about the place of first aid in our society, why, when, where, and what. As plenty people go all learn plenty thing, but how forgive for state, but different thing they wake it happen. So plenty thank you we joining at the program. Plenty thank you to the one that we call and ask questions and self make them contribution at the program. And now we go end this program with Bodi Talk on Thursday, August 6, 2026. Plenty thank you to my producer Musa Kamara, DJ Randy for in technical support. Mary Kamara Bango will make una watch you live on our Facebook page. And we will present this program. My name na Karifa to contact. They say not forget for listen next week Thursday as we will come with another topic again. Same time 5 to 6 o'clock evening time. Bye bye.
No condition.
The condition is permanent. Yeah.